In this video, we are going to learn about the aerosol packaging systems. So, aerosols are mainly defined as the dispersed phase systems in which the finely divided solid particles or a liquid droplets get dispersed in a gas which act as a continuous phase here. So, that means the solid particles or liquid droplets of the medicament get dispersed in a continuous phase here. This continuous phase is obviously a gas, that means a propellant. Okay. This propellant is mainly responsible for to create a pressure inside the container. As a result, the drug will get expelled from the container. Okay. So, a pharmaceutical aerosols are mainly defined as the preparations containing the active medicament dissolved, suspended, or emulsified in a propellant or a mixture of solvents and propellant and are packed in a specialized aerosol containers. Okay. When little pressure is applied on the valve attached to them, the medicament is released in the form of a mist or aerosol spray. Depending upon the type of the valve, the medicament will release. Okay. According to the present day uses, an aerosol or a pressurized dosage form is defined as a system that depends on the power of compressed or liquefied gases to expel the content from the container. It is in light of definition that term aerosol, pressure pack, pressurized package are used here. Okay. For aerosol systems, the propellants used includes commonly compressed gases such as carbon dioxide, nitrogen, or liquefied gases like methane, ethane are used as a propellants here. Liquefied gases are more commonly used as a propellants because they maintain a constant pressure until last drop of the product is taken out from the container. Okay. For potent drugs used in asthma, the valve includes a metering devices which delivers only a meter dose on applying the pressure on the valve. Okay. The patient should be warned not to exceed the prescribed dose. So these are the special types of the metering devices nowadays available in the market. Now let us see the various advantages of the aerosols. The first one is the medicament can be delivered directly to the affected area such as burn skin and wound. So it minimizes the discomfort caused by the mechanical or a manual application here. So that is the first advantage of the aerosols, and the second one is the absence of the air prevents oxidation of the product, and third one is the hydrolysis of the medicament can be prevented by this type of dosage forms, and fourth one is the drug can be given by oral inhalation. So in case of asthmatic conditions, we will see this type of the sterility of the products can be maintained here. The application of the medicament is easier. A fine mist is easily formed for inhalation purpose. Manual contact with medicament can be avoided due to the building up of the aerosol container systems. So as a result, there will be less contamination. Drugs given by oral inhalation do not pass through GIT, so hence its chances of decomposition are less here. So these are all the various advantages of the aerosol systems. That is, a dose can be removed without any contamination. That is the first advantage. The stability can be enhanced for those substances adversely affected by oxidation and moisture also. And medicament is delivered directly to the affected area, and irritation produced by the mechanical application of the topical medication is reduced, and there will be a rapid onset of action can be seen by this type of dosage forms. Coming to the disadvantages of the aerosols. So the aerosols are the costly preparations compared to other dosage forms. Some of the propellants are very toxic here. Without propellant, we can't prepare the aerosol systems. So sometimes these propellants are somewhat caustic to the product. The cooling effect of the highly volatile propellants may cause discomfort on the injured skin, and a lot of difficulties are faced in the aerosol formulation when the drug is not soluble in the propellant. So these are all some disadvantages of the aerosols. So coming to the classification of the aerosol systems, aerosols may be classified as space sprays, surface coats, and foams. So we'll see one by one here. The first one is the space sprays. So these are finely divided sprays having a particle size up to 50 microns. Example, insecticides, disinfectants and room deodorizers. And second one is the surface coats. These are also sprays, but dispersed particles are coats with size up to 200 microns. They produce a wet coat when sprayed on the surface. Example, hair sprays, personal deodorants, powder sprays and topical medicament sprays. And third one is the foams. So these are produced by rapid expansion of the propellant through an emulsion. So hence the product comes out in the form of a foam or froth. Example, shaving creams. Formulation of the pharmaceutical aerosols. An aerosol formulation basically consists of a propellant and the medicament to be propelled. So first we will see about the propellant. It develops a pressure in the container. Compressed gases such as carbon dioxide or nitrogen and liquefied gases like methane or ethane can be used as a propellants. Compressed gases are not commonly used. These days, propellants like trichlorofluoromethane, dichloro-difluoromethane, dichlorotetrafluoroethane, difluoroethanes are used in the pharmaceutical aerosols as a propellants. Okay. The medicament to be propelled may be a solid or a liquid. It may be a soluble in the propellant or insoluble in it. So the various additives such as solvents, antioxidants, surface active agents, flavoring agents are also included in the formulation. Here, the propellant, medicament and additives are filled into an aerosol container properly to prepare a product. So the aerosol system may be of two types, that is two-phase system and three-phase system. Two-phase system is employed in case where the product is solid insoluble in the propellant or it is solid or liquid which dissolves in it. In the first case, solid is suspended in the propellant so that the aerosol system will have one phase, that is liquid phase, and gaseous phase is above it. So that's why these are two-phase systems. And second one is the three-phase systems. Three-phase system is employed in case where the product is immiscible with the propellant. The medicaments are dissolved in a liquid which do not mix with the liquefied propellants. Okay, that's why there will be a formation of a three phases is seen here. Okay, that's why these are called as three-phase systems. So okay, the aerosols may be of two-phase or three-phase systems. So we will see in the next video about the containers and the packing of the aerosol. Thank you for watching this video. Please subscribe to our channel for more videos.